Hey everyone, welcome back to the channel. My name is Aryan Malik. This is Study With Me series, and today is day 27. We'll be continuing our discussion on fundamentals of nursing, and today we'll be understanding the anatomy and physiology of breathing. It is very essential to understand the basics of breathing because that is what helps us in navigating through the pathophysiology of respiratory diseases and other diseases which impact the breathing of a client. So let's get into it. As we might know that we have a right lung and left lung. The right lung has three lobes while the left lung has two lobes. As a registered nurse, it is our responsibility to assess the sounds of the lung, and we do that by placing the stethoscope in the intercostal spaces, or in other words, in between the ribs, to assess and hear the sounds of the lung. Now, let's look at the flow of air through, like when we inhale it, from which passages it goes through. So first it passes through the trachea, then the bronchus, the right and the left, which further branches into bronchi, then the bronchioles, and finally the alveolar sacs, the place where all the action take place. By action, I mean gas exchange. Here, we exchange carbon dioxide for oxygen. As you all know, we breathe out carbon dioxide and we breathe in oxygen, and this happens basically in the capillary beds of of each alveolus. Um, Now, how does it works out in case of a disease? Say a patient with right-sided heart failure will soon depict pulmonary edema, meaning fluids in the lung, which is a result of fluid in the lungs. So they have wet lungs. So the body will have difficulty in transporting oxygen to the alveolar sacs because of the wet lungs. And in diseases like atelectasis, wherein the alveoli they get damaged, hence the infection is able to penetrate further, resulting in pneumonia. The process of respiration is accomplished by inhalation of oxygen and exhalation of carbon dioxide, and it is dependent on many factors like clear airway. There should be no obstruction of airway. The central nervous system should be intact, especially the brain stem, because it controls the breathing impulse. And we should also have intact thoracic cavity, especially diaphragm, because it helps to basically expand the lungs to get the oxygen in. And there should be adequate pulmonary compliance and recoil. What I mean by that is that if alveoli are scarred due to long time smoking, then the compliance and recoil will be decreased and hence won't allow for gas exchange to occur. Now, there are some key terms to remember: external respiration, which basically means the exchange of oxygen and carbon dioxide between alveoli and pulmonary blood, and internal respiration, which means exchange of oxygen and carbon dioxide between blood and cells in the body. Now, let's look at some factors that affect the respiratory system. The first is environment. It varies on where you live. For example, do you live in an area with high pollution, high elevation, and high temperature are all the factors that may impact your respiratory system. Second is lifestyle. What kind of lifestyle does a person live? Are they an active smoker? Do they have a sedentary lifestyle? And do they have excessive stress, which can all impact the lung compliance, decreasing it, and um, as a result, the alveoli becomes really hard and stiff. It can other factors that can also impact our medications. Some medications like opioids, whose main function is basically to slow down the body, result in low, slow, and shallow breathing pattern for a client, which has an impact on respiratory system. The last factor, which kind of is impacting the respiratory system, is basically aging. So with aging, the body starts to slowly deteriorate, and which in turn leads to decreased lung capacity and elasticity, which when combined with weaker respiratory muscles leads to increased work of breathing, increase anterior and posterior chest diameter, hence impacting the respiratory system. The older clients also have decreased cough reflex, making it hard for them to expel foreign particles. Hence, they the material it's trapped in the form of mucus, which increases the risk for respiratory infections like pneumonia. Lastly, they also have abnormal breathing patterns that can affect their sleep, leading to sleep apnea. This marks the conclusion of this video. I hope you found this helpful. Please stay tuned for more videos that will be coming out in the future. Thank you for watching.